some type of linen with different filaments inside of it also, and it feels like paper. And the newer bills are really crisp and they stick together, just like if you put a lot of starch into your linens at home. It's really hard like that. To show you the difference between that and the Canadian bills, here are the Canadian bills. Definitely much brighter colors. They are made of what's the word now? I'm drawing a blank. They're made up of polymer, a polymer material, and it really feels like a piece of plastic in your hands, like a piece of paper made out of plastic. And they have different security features, just like the U.S. dollars, but that's what they look like. And I noticed that on the back, I had a $5 bill here. On the back, like for example, on the back of the Canadian $5 bill, which is the blue one that we saw, it shows a picture of, I think, Canada's contribution to the International Space Station, and then you have kind of that name. So there's historical events or historical figures that they put on the back of the Canadian bills. So those are some of the differences. I'll show you the current exchange rate for the two. What is 100 US dollars in Canadian?
That would be $125.11.
So that's US to Canadian. Now we'll do Canada to US. What's 100 Canadian dollars in US?
It's $79.91.
So that's the difference. And I got hit pretty hard when I came up here in 2007. When I came up here in 2007, that was when everything happened with the housing crisis in the States. So I have my US dollars that I need to convert into Canadian, and I'm actually losing money. Whereas historically and at the current moment, usually when you convert US into Canadian, you're making some money there. And I remember looking at the currency exchange back in the mid to late 90s. There was, it was like $1.84. $1 Canadian, $1 US is about $1 Canadian is about 84 cents on the US dollar. And another very interesting point is they don't have dollar bills in Canada. They only have coins, and they have a $1 coin and a $2 coin. Show me a Canadian loonie coin.
Here's what I found on the web for Canadian loonie coin.
Okay, it's taking me to the website. So here is the back of a Canadian loonie coin on Wikipedia, and here is the front. You'll notice it's the Queen of England, Queen Elizabeth II. And she is the leader in Canada. In Canada, they have the Queen, and then you have a Prime Minister. It's part of a Commonwealth with Australia, England, Canada, and other countries as well. And I'll show you the $2 coin. So they have no bills for these. Show me a picture of the Canadian coin toonie.
Here are some images of the Canadian coin today I found on the web.
No, that's not it. Show me some pictures of a toonie.
Here are some
Okay, we'll get there. Show me some pictures of a $2 Canadian coin.
Here are some images.
Okay, here we go. So this is a picture of a $2 Canadian coin. Now, because on the back of the $1 coin, it has a loonie on it, they call them a loonie. So a dollar is a loonie, and a $2 coin is a toonie. That's what they call them here in Canada. So those are the basic fun facts as far as the Canadian currency is concerned. Now I'm going to put my iPad aside, and we're going to talk a little bit about the healthcare system. So again, there's no judgment. Every country has their way of looking at things. Basically, what I notice, the main points that I notice is, yes, in Canada, it's free healthcare. In the States, you have to pay, or you have to have a really good insurance. That is very true. But at the same time, there are some basic differences. So I'm going to stop the video, and then I'll be right back. So there are some main differences between the healthcare system. Namely, obviously one is free in Canada, one is very expensive in the States, but it goes a lot deeper than that. There's a two-tier system in Canada. So in Canada, you have the public, which is free in most cases, and then you have the private, where you have to pay. It's not usually not covered by the public system. You have a healthcare card that you should always keep on you at all times in case you have to go to the emergency room or anything like that. And that's something that's part of the public system. The two are not mutually exclusive. If you need to delve into the private sector and you have the money to pay for it, then you can do that as well, and it doesn't affect your coverage on the public system. However, that's on a day-to-day basis, that's okay. But let's say you have something bad that happens. You need an MRI, you need an X-ray, you need a CT scan, something like that, or something that's not, it's not a blood test, it's not something routine. If you are on the public system, you oftentimes, and again, this is my experience in Montreal, but I hear this not only ear to ear, but on the news and stuff like that about other provinces also. You have to wait up to 3 months, sometimes a little bit more, to get your appointment for your MRI or your CAT scan or whatever the case may be. That's a long time for someone who has cancer, for someone who needs this test to move forward in their treatment, because you need a diagnosis before you can actually move forward with the treatment. So that's a long time. So if you have the money, or you have a private insurance that covers it, you can go to get your MRI, or to go get your CAT scan, whatever the case may be. You can do that through the private system and pay. Obviously, just like in the States, it can be very, very expensive. And it is true that in the States, if you don't have healthcare through your employer or private healthcare, that your healthcare can be very, very expensive, especially emergency room visits and things like that. But there's also the Hippocratic Oath. And every doctor in the entire world should be putting this into practice, but they don't always do that. The Hippocratic Oath is something that my doctor at Princeton Medical Associates did. And he was an amazing doctor. He gave me free and reduced priced healthcare, doctor's visits, medication, as much as he could. He helped me save money. So he really helped me a lot through high school, not high school, but college, and things like that. And at the emergency rooms, yes, it's expensive, but you can also apply for charity. There are different religious and non-religious charities that you can apply for at the hospitals in the States to help you out with some or all of those costs. So, it's not like you're being refused care. Care will not be refused to you if you don't have a private insurance and you can't afford it. But yes, in many cases, you can end up getting a huge doctor's bill. So those are a couple of the main points. Another thing is that in Canada, there's a shortage of doctors, especially family doctors. There's a lot of reasons for that, but I won't go into those. But it took me 10 years. It was in 2016 that I finally got my family care practitioner, my family doctor, my own personal doctor. Before that, and they're getting better at this too in Montreal. Before that, when I first came to Canada, if you get sick or you have to see a doctor, for whatever reason, you had to go to a clinic very early in the morning, wait in line, sometimes in the freezing cold, the bitter winters that are in Canada, that you're experiencing in Canada, and you have to wait through through the process, and hopefully you get in. Hopefully there's enough room for you. If not, you have to come back to the afternoon session and wait all over again. But now they have a system where you call the night before. In most clinics, you call the night before, they set you up an appointment for tomorrow, and nobody has to wait outside. So they're getting better. It's still not very personal. You're not speaking to someone. You're actually going through a system, an automated system, but at least it's something. It is an improvement on that level. But it took me 10 years to get a family doctor who I can call up and say, hey, I need an appointment with Dr. So-and-so. Can you fit me in? And then we make the appointment. And I'm having trouble with my ankle, and I think a pinched nerve in my neck is what my doctor says, and I need a couple of MRIs for that, and I have to go private. Thankfully, my insurance covers half of that price, but there's no way I'm waiting 3 months for an MRI. When I don't have to, and it's a shame that not everyone can take care of it that way, and it shouldn't be that way. But that's if you're able to, then most people who are able to just go private. So that's what I'm doing on that level. Otherwise, it's 3 months. In 3 months, you're sitting there worrying, does anyone really care about me? What's going on? What's going to happen to my body and stuff like that. So if you can go private, most people end up doing that at some point in time in their lives. And there's a lot of wait time at the emergency rooms. I'm sure in some places in the States there's wait times too, but the average wait time in Canada is up to 24 hours, 20 to 24 hours. Those are the last numbers I heard. I haven't heard any numbers for 2017, or obviously we're very early into 2018. So those are the main differences between Canada and the States as far as healthcare is concerned. Obviously, I can't touch into all the points. There's so many different points that I could cover, but please let me know what I'm missing or what else you want to hear about in future videos. We could definitely do a part 2 of this, definitely do another set of points. I tried to cover everything that you guys mentioned on Facebook because that's what was interesting to you. Thank you guys for watching. I really appreciate it. Thank you for being subscribed if you already are. If not, please subscribe, hit the bell notification so you can be made aware of future videos and always tune in. And please give a thumbs up and don't hesitate to leave comments. Any type of comment, as long as it's constructive and positive, I'm more than happy to have them. So I wish you guys all the best for 2018. Esinam is still around. She'll be in the videos definitely in the near future. But this video was just something I wanted to do, to show you guys a little bit of the differences. So thanks for tuning in again. All the best, and we will see you on the next video. Daddy Daughter Broadcasting, signing out for now.